Now, discussing the T1 and T2 weighted images, the basic appearing difference will be that in T1 weighted image, the darker areas will be having more water content. So, the body parts or tissues having more water content will appear darker in a T1 weighted image, and fatty tissues will appear brighter in a T1 weighted image. Remember, uh, pay attention here that we are discussing about the T1 weighted image. Darker tissues will be the one with more water, brighter tissues will be the one with more fat. So, here I have stated the examples of abnormal conditions where water may be increased, that is inflammation, any kind of inflammation, any kind of edema or swelling, any kind of hemorrhage, infarction, and infection. And apart from fatty tissues, other brighter appearance substances can be gadolinium, which is a contrast agent used in MRI. Then it can also be there in cases of laminar necrosis of the cerebral infarction. Right. To the contrary, T2 weighted image. In case of T2 weighted image, the darker tissues will be with calcification or fibrous ones. So any kind of fibrous tissue will appear darker. Any kind of abnormal calcification or normal calcification will appear darker, and the brighter will be the same as the darker in the T1 weighted image, that is the tissues with the more water content. So the same conditions apply here: inflammation, edema, hemorrhage, infarction, and infection. Right. And if you see these kind of terms in an MRI report, hyperintense, hypointense, intermediate. Hyperintense just means bright, which is simply white. Hypointense means dark, which is simply black, and intermediate intensity means gray.